Tonight's chat is brought to you by HPA Balance and Adrenal Repair. Stay tuned to get a $10 coupon off your purchase of $50 or more, valid only on Holtraceuticals.com until June 30th.
Holtorf Medical Group is proud to present this month's health chat with Dr. Nancy Evans, all about adrenals. Dr. Nancy Evans brings a holistic approach to Holtorf Medical Group as the first naturopathic doctor to join our centers. Tonight you will learn about the adrenal glands, the causes and symptoms of adrenal dysfunction, and most importantly, how to avoid the crash. Our presentation will begin momentarily.
Good evening, everybody. Welcome to Health Chat number 5. Now remember, we talked about perimenopause, we talked about menopause, Dr. Holtorf talked about thyroid disorders, and we also talked about weight management. So as your doctor is prescribing various treatments for you and diagnosing any of these symptoms, you want to go ahead and look those up on our site. We're starting to compile a really nice set of videos for you to learn about your health. And my intention always is for you to obtain optimal health so that you can live out your life's purpose. And many of us in midlife now are redefining ourselves, and we're needing to make sure that our health is really in top shape as we're approaching the second half of our lives. So tonight's topic is all about adrenals. Adrenals has become kind of a catchword now. It's pretty common. You hear it talked about a lot. There are a lot of supplements out on the market. Cortis Slim, Cortis, you're seeing all these ones with that quart, and I'll explain to you what that's about. These are adrenal supplements, but I think many of them are being misused. So we want to be careful about buying things over the counter if you haven't had your blood levels checked, and really to find out what are the state of your adrenal glands. So let's plunge right in. The adrenal glands, where are they in your body? What do they do? And how do we manage them? So the adrenals sit on your low back, above, ad means on top of or in addition to, and they sit on top of the renal glands, which are the kidneys. And the reason why they sit there is because they do have some function that relates directly to the kidneys. The adrenal glands, so if you look at them too, so here are your kidneys, and they're sort of these kind of tent-like shaped organs on top there. And what's interesting about them too is they're kind of 3 organs in one. They come from different embryological sources, so they actually have these three or four really different functions that they do in the body. So we're going to talk about what the functions of them. The adrenal glands produce 4 major hormones, and we're going to talk about them one by one. They have quite a different function in the body. The first one actually is, and it's probably one you haven't heard of, aldosterone. So aldosterone is the one that's most related to the kidneys. Aldosterone controls our blood volume. So if we control our blood volume, we're controlling our blood pressure. So this, mainly what aldosterone does is hold us from having our blood pressure not drop too low. Well, of course, we're always concerned with our blood pressure being too high, and aldosterone, if there's any sort of tumor here, it can cause high blood pressure. But we're talking about sort of less severe cases. So aldosterone, what it does is it tells the kidneys to retain salt, and water follows salt, so then it retains water. So it's giving enough blood volume in the body. So what does this look like clinically? This is the person who comes in who's fatigued and gets lightheaded if they bend over and stand up, and then also if they're hypoglycemic, but we'll talk about that too. So it's this kind of lightheaded, and they usually have very low blood pressure. Often it's a thinner person, but something that just gets drained very easily. A couple of my mentors have talked about too with aldosterone. This is the person when they come home, and if they're reading a book, they want to lie horizontal rather than sit up. They get tired standing too much, and it's because they don't have enough blood volume in their body, and so they're just lightheaded and a little dizzy also. So what do we do about this? The first thing to do, and let's talk about testing. We can test this in the blood. We don't do it very often. It's not the most accurate test because it has a very short half-life. Right, aldosterone is checking moment to moment what our blood volume is, and it's making sure that it doesn't drop too low. So it's not necessarily worth checking in the blood. We can, but it's not the most accurate test. So what do we do about treating this? The best thing actually for this is just to give whoever's feeling this way, and especially if their blood pressure is low, is to start the morning with some salt water. So take a nice glass of water and just put a little bit of mineral salt in it, that pink salt, Mediterranean salt, Himalayan salt, any of those. Put probably just a little sprinkle in it first and kind of work up. If it feels too much like it's sort of ocean water, it doesn't taste right, do it to taste. Most people who have this adrenal fatigue and have this low aldosterone, low blood, it tastes wonderful to them. It's also this person is often a little colder also because they have this low blood volume. So when they have the salt water, they feel a little fuller in their body. They feel kind of their face might get a little bit redder, and they just feel more robust. And especially this person, as I was saying, they're kind of lightheaded and dizzy a lot. So that's really the best thing to do, and then to also increase salt in the diet. We're always talking about salt being bad for you. It's not. It's another mineral, especially in the ocean. It has many, many other minerals in it. Aldosterone cannot work if we don't have any salt in the body. Remember it, because it's saying retain some of that salt. So it's controlling the low end of our blood pressure and blood volume. So it's a really important one. This has made quite a difference in some people's treatment. They just wake up in the morning, have a nice glass of salt water, they just feel a little fuller and more robust. The other way to treat this also is with a medication. So we do have a medication that is an aldosterone agonist, and it's called fludrocortisone or Florinef, and it's prescription only, and what it does is it keeps the blood pressure up. So obviously if you have high blood pressure, this is not the medication for you. And some people, it's a very sensitive medication, so if many people take it and they almost feel like their blood pressure just goes too high too fast. It's a little bit tricky to adjust. There's only one dose. It's a tiny little pill, and I'll even have somebody take a quarter of a pill if they're really feeling like they need it. But it can make quite a bit of difference. So a lot of people think their fatigue is only related to thyroid, but it's also related to the adrenals. So that's the first. This is called a mineral corticoid. This is the first part. The adrenal glands. It's the first. It's on the outer. It's one of the first hormones that gets adjusted with the blood. So the next set of hormones, the one that you've probably heard the most about, is cortisol. Okay, so cortisol is the hormone of stress. So if you think about this aldosterone, it's a little bit more the emergency, right? It's just keeping us alive. We wouldn't want our blood pressure to drop too low. Cortisol is also for stress and emergency, but this is just even to keep us alive at all. This is to help us run from the tiger. So how does cortisol work? We don't want it too high, and we don't want it too low. Where do all our hormones come from? They all come from cholesterol. So this is another really important thing to recognize. Is cholesterol bad for us? Everybody thinks it is. Cholesterol is an endogenous material that we make in our body. We call it a steroid, and the steroid just refers to a certain molecular structure that's fat soluble. All of our hormones come from cholesterol. So we want to remember, is cholesterol good or is it bad? We don't necessarily want it too high if our diet isn't healthy, but this is something we produce in our body. Everything we produce in our body cannot be bad for us. It helps us. We want to just always keep things in balance. So cholesterol converts down to these various hormones, and the first one we are talking about is cortisol. So cortisol comes from there, and cortisol is our hormone of stress. How does it work? It's high, we produce it in the morning. It's high in the morning when we first wake up. It gets us out of bed in the morning. And then it slopes down through the rest of the day. And when nighttime hits, darkness comes in through our retina, and it turns on melatonin in the pineal gland. So the melatonin and cortisol also work hand in hand. Cortisol does turn on because of sunlight as well as our own circadian rhythm. So how do we test for cortisol? There's 3 ways to test, 2 ones that are more common. We can test in the blood, which is fine. What I'll do is I'll have you go get your labs done between 7 and 10 a.m. in the morning, so you're fasting and you're getting your blood drawn. The body perceives this as stress, so I want to know, under a stressful circumstance, do you produce enough cortisol? We're going to talk about when it's too high as well, but mainly with middle-aged patients, we're looking about cortisol is often too low. I'm going to talk about when it's too high, but we want to make sure, again, we have enough resources to handle stress. So in this blood test, there's the range between 15 and 20. I like to see it right in that range there in the upper end, just knowing that you produce enough. And I'll always ask a patient, were you stressed when you went in there? How long had you been awake? How long had you been fasting? And just make sure that we're getting an accurate reading. The other way to test cortisol is through a saliva test. And that is done, do it 4 times in the day. We do it upon awakening, so around 8 a.m., do it again around noon, again around 4 p.m., and then 10 p.m. or so. Now this is a better picture because we're catching you out throughout the day and looking to see what this cortisol curve looks, but both of these are snapshots. So one day if you're having a calm day, or another day if you're running around, if you've just gotten some bad news, we're not going to see an exact day-to-day. So a lot of this is really done. You just want to be with a clinician who really understands this whole process and can interpret what we see in the levels. So the cortisol curve looks like this. So this is AM. And we want your numbers to be somewhere in here. So this is a healthy human being. As I said, you wake up in the morning, you have energy to get out of bed, you can go throughout the day, and then when our energy is supposed to calm down, it lowers down throughout the evening. And then melatonin takes over in the dark and puts us to sleep. So what kind of pathologies or imbalances do we see with cortisol? The first one in the video we saw where our friend Mike was in the background racing around, that's the high cortisol adrenaline person. Now typically that person doesn't even come into our office because they feel great. They say, I get everything done, you know, and I can work hard all day long. I only get 3 hours sleep. I don't even need coffee. I get everything done. I'm just the most productive person in the world. I love my job. I never sleep. And I'm, you know, they're just rattling off and they're the big, powerful person. That's kind of the type A person. As I said, we don't often see that person in our office because they're feeling so great. They're producing a lot of cortisol. Their adrenals they're probably producing cortisol in spurts and then it's relaxing. They're probably not constantly on this high cortisol. They have very resilient adrenal glands and it's getting them through these stressful moments and they just rebound. And this is how we felt when we were younger too, right? We'd fall down or, you know, we'd run and we'd fall down, something would happen to us, we recover, we fall asleep, take a nap, we wake up, we're happy. So this kind of resilience. When we're older, we're getting less of this. So that person is the healthy one. They just got a lot of, you know, resilience throughout their day. So, but the thing is that person who's been really pushing their adrenals, they come into our office 5 years later and they say, this is my 5th cup of coffee. It doesn't do any good. I sleep. It doesn't do any good. Nothing's helping anymore. I'm just fatigued all day long. So that's the person who's challenge their adrenal glands all the time and now they're aging. They may have had a major stressor in their life, whether it's a divorce or an infection or a car accident or just some stress at work, or it is just simply aging where they're just not producing adequately anymore. So that person we start seeing, they come in and the first thing they might say is, it's just hard to get up in the morning. So their cortisol might look something like this. They might just say, you know, it's just the mornings are tricky for me, but I get going and I eat some protein and I'm fine throughout the day. So this person, we want to support their adrenals in the morning and we can give some supplements and I'll talk about those in just a moment. So this is starting to be towards adrenal fatigue or adrenal insufficiency. And there's a little controversy about whether we should use these terms or not, but they're clear that it's a suboptimal production of these glands. So there's no reason that we should definitely be treating and optimizing it for your health. So the next person we might see is the person who's just completely flat. This is the person who they can't get out of bed in the morning. They have coffee that doesn't work. They exercise. Before, like this person who's a little low, they go exercise. They say, yeah, it feels good again. I can get my adrenaline going. I can get my energy back. This person now, even exercise, they don't get that nice kick of energy that they used to get anymore. They're not producing the endorphins, which are also part of the adrenal glands. So they say, yeah, I work out now and I'm just fatigued. It doesn't even seem to matter whether I work out or whether I don't. So this person is getting closer to a pretty severe adrenal fatigue or insufficiency. And this person, when I check their blood levels of cortisol in the morning, they're going to be quite low, definitely under 10, probably something like closer to 5. So this person, it means that under stress, remember they did fasting for that blood draw, under stress and getting their blood, needles coming into them, that they didn't even produce enough to get out of bed in the morning. So how are they going to combat their stressors during the day, where they have their kids or their job and all sorts of, or if an infection comes around? So this person we need to support a little bit more closely. The third person is somebody who starts somewhere in here and they go like this at nighttime. What is this person? This is a person who's fatigued all day long. They're kind of struggling to get by. They can kind of do it. They, go for their exercise, or they drink their coffee, or they just push themselves to focus. They're very disciplined, but they're just still struggling all day long. And then if they don't go to bed, but it's usually around 9 o'clock, if they don't go to bed, then all of a sudden they're wired. And what happens then is they actually say, this is the only time I feel good. And I'm sure it's happening to some of you. And it's not just the night owl. And it really has this picture of this deep fatigue as the base. So this person, what's happening is they're not producing enough cortisol here. And then when that darkness came, they probably had their laptops on, or they were watching TV, or they were out driving somewhere. So there's light coming into the retina. The lights said, don't make melatonin. It must be daylight. Your body thinks it's the sun shining, and it says, okay, and then all of a sudden it gets a nice little push of cortisol in the evening. So as I said, this person they like it, they feel good that time of day, but then it's going to collapse. They're going to collapse because they don't get enough sleep, and it starts all over again. So this person, we want to drop down their evening cortisol. And this would show up in that saliva test. Again, I can usually tell clinically when I'm talking to somebody, if they give me this picture, I know we have to find ways to sort of calm them down in the evening. So cortisol does a few other things too, and it controls it controls blood sugar. So when we fast or go from one meal to the next, you're hungry. Say it is a longer fast. You're hungry, so your brain needs some glucose. That's how we get all our energy in our body. And we haven't eaten. So cortisol says, okay, we need something. It tells the liver to burn some glycogen. There's some storage form of sugar there. And it also tells the liver, make some new sugar because we have to get moving. There's no food in sight. So this is the person, if they have low cortisol, they are hypoglycemic. This is the person who feels shaky. They might even break out into a sweat, and they really feel like all of a sudden they say, I just have to eat now. So this is another clinical picture of the person who has low adrenals, mainly this low cortisol. Cortisol is the hormone that gets us through danger. So it's a survival mechanism. Most of our functions in the body are about survival. How do we keep the species going? That's why we're so healthy when we're young, because we're robust so that we can reproduce. After we've reproduced, the genetics can't really affect us anymore. So a lot of these functions decline in the body. So cortisol, the picture, this main stress picture that was discovered by Hans Selye, is that we're supposed to, like in nature, we're being chased by the tiger, so we need a lot of energy to combat, to run from the tiger, and hopefully we escape, and then we can go back into rest. And you see that with your kids, right? They'll scream for a couple minutes and then they're asleep. Or you'll see that with your dogs. They'll race around the house and then they'll just lie down. So that's what the healthy stress response should be. And what is going on during that stressful time with this high cortisol? Remember, this is like the fire department. This is helping us get through the stressor. So the first thing it does is increases blood sugar, so we have energy to run. Another thing it does is that it diverts our blood. So it says it vasoconstricts some blood vessels and dilates others. Basically, it sends all the blood to the large muscles of our legs so that we can run. So that's the cold sweat feeling. So if you start to feel your skin getting cold in that sweat, so this happens to us maybe if we're doing a public speaking, or it happens to us if we're walking down the street and somebody scares us, right? You go right into that cold sweat. So it's the body's way of taking all the energy to the important places of the body so we can run, assuming that it's not going to last very long. The other thing it does is it shuts down the immune system. Why? Because if we're running from a tiger, we don't have time to stop and have a runny nose and to heal our sore throat, or to basically combat the infection. The immune system, we just don't have time for that. So these are all really great survival mechanisms that we have in the body. The other thing it does, since we increase that blood sugar, we also reduce insulin. And so basically, sorry about that, it's a little bit of a mixed picture. The glucose and the insulin picture changes. Basically, the body says we cannot deal with it now, and in the long run, we actually are going to store fat. There's a little bit of burning fat initially, but the whole system it's basically a shutdown of the system for emergency. So think of that alarm in the factory. So things are not working very well, except for we're just trying to get through the crisis. In our modern society now, we're always under stress. We don't rest enough with electricity, we're not sleeping enough. So this whole picture is the body doesn't know if we're racing from a tiger or if we're just upset with our mother-in-law. The brain produces these same chemicals. So what do we do about it here? So again, we've tested, we've done blood tests or saliva tests, and we've looked at these basic levels. The first thing to do for either of this person is just to see if we can support the adrenals to produce more. And the way to do that, there's some really good herbs. Eleuthero is one. It used to be called Siberian ginseng. You can get it in a syrup form. It's also found in pretty much every adrenal formula that you find. There's a little bit of eleuthero in it. There's ashwagandha. There's some different ginsengs, a couple different ones that are also helpful for this. So they're stimulating the body to produce more cortisol. So that's the best one. We have a great one that I love using. It's called Adrenal Repair. And I have people, again, it's only if they're showing some of these symptoms. I have them take 2 in the morning when they wake up, and another 2 at noon, especially if they're getting one of these kind of energy dips in the afternoon, right? So most people talk about that when they have adrenal fatigue. They say, I'm tired in the morning, I kind of get going, but 2 or 3 o'clock I crash. So then I have them take some more of these herbs around noon or 1 o'clock. The other thing that's in this formula, in many adrenal formulas, are glandulars. So we take animal adrenal cortex or medulla, that's a different part of the adrenal gland, and we synthesize it, and then that's in the formula. So we're getting the actual hormones sometimes, or we're getting the precursors of the hormones. So it's really just stimulating the body to do its work. We also, the one that we have that doesn't have, that one has some bovine glandulars in it, so it's from cows. And if you don't want to take any animal formula, then you just take the botanical one, and that's called Adrenal Repair V, so vegetarian. So that one does the same. It's not quite as robust, but we can do that. The other thing to do here is to prescribe cortisol. Now this is for the person who's severely fatigued. Also, they probably are getting infections a lot. Lots of colds, lots of flus. For that same picture, that it's when we're under stress, our body can't fight off infections. If you think about it, this is like taking a final exam. Probably all of you have done this, if not, your recent past. You'd take a final exam, you'd pull a couple all-nighters, you'd study hard, you'd make it through the exam, you go to Hawaii for vacation, you get sick as soon as you get there. So that's what it is. You made all this cortisol to get through the stressor of the exam, to run from the tiger, and then you got to rest, and the body said, okay, what do we need to do? Oh, there's some viruses in here we need to fight off, so the body does its kind of cleaning and its whole immune adjusting. So that's that picture of the whole. So the person who's getting all these colds and flus, they're not making enough cortisol to get through the day. The other, so cortisol comes in, there's a medication, it's called hydrocortisone. That's the medical name for it. The prescription is Cortef. It's a tiny little white pill, and that's instant release though. So sometimes that's good. Sometimes we prefer to do a sustained release cortisol to just give you, it's kind of like giving the floor underneath you so that we can sort it out through the rest of the day. And these are prescription only. Now this one, people get nervous about that, say, oh, cortisol, cortisone, all of this. The reason why people are so afraid of this is because of the pharmaceuticals. Prednisone, all of these different ones, they are in different ratios, are 10 times and even 40 times stronger than the cortisol we make in our body. So if we give too much cortisol, it's doing what we've been talking about. It shuts down the system. So that's why people have all this immune dysfunction. And if you're on these high dosages, then you want to make sure you taper off slowly. So we use, they'll use prednisone in the case of a very, very severe infection also, where the immune system is being overloaded and or it's an autoimmune picture where the immune system is really overworking, working in the wrong way, and we have to shut it down for a moment. So it's a good emergency medicine, things like prednisone, but it's not something that we're not talking about that. What we're talking about is giving you enough cortisol just to get you to here. So that can be anywhere. Usually it's just a small 5-10 milligrams in the morning. We might get you up as far as maybe 20. The studies are really good. When we take them, you don't absorb all of it anyway, but we're basically just adding enough cortisol to continue getting through the day. And we hope to not have to give you that for too long. Chances are, if you've got fatigue, your thyroid is probably not well managed either, and your hormones may not be either. You may have these infections going on, so we always want to work in this complete picture in the body too. That's why we're doing all these talks, so you can learn about the different systems that have to be worked together. This person who late at night, they have that high cortisol, there's a very interesting substance. It's called phosphatidylserine. It's with pH. I'll write it up here. It's a fat-soluble substance, and what this does is it lowers cortisol. So this is a really good one. If I see this person who gets wired in the evening, we've got to get you sleeping. Even though you love that time of day, we have to slowly teach you to calm yourself down, and then we'll do it with one of these supplements. And then some of these adrenal herbs actually are adaptogens, so they can actually balance your adrenal hormones. They can kind of raise them if you're low, and they can also lower them. They kind of work synergistically with the function of the glands. So you want to take this in the evening, or if you're getting a spike sort of midday, or if you're the person whose cortisol is high all day long too, then we can add in this phosphatidylserine. We have a supplement, it's called HPA Balance. That H is for hypothalamus, pituitary, adrenal function. So it's working on that whole system so that you're not in this fight or flight state. So that's what we've been talking about is fight or flight. We see a danger, we're either going to fight our way through it or we're going to run. So it's all about survival. There's a lot of talk. So what do we do with high cortisol states? So this is stress. So what's interesting is we say, oh, I don't feel well. Oh, I know it's just stress. So what is stress? Stress is the state we've been talking about. Your body perceives a threat, and so your body produces chemicals to help you survive. And then we just talked about all the damage that can do. So this is why stress is bad for us. A certain amount of stress, of course, it energizes us, it gives us passion, it helps us get through the day, it helps us be productive. But if we're always on this high cortisol, if we're on this high stress, then we're producing this cortisol all the time. As I said, shutting down the immune system. It also does things, it lets go of actions in the body that are not that important under a crisis. It stops producing collagen, so people get kind of thin, papery skin if they're under stress, or if you've seen someone who's been on prednisone, their skin kind of just gets papery. When people have had cortisone injections in their back, which may be fine for a ruptured disc, it actually sort of degenerates the tissue around there because it's just trying to, it's trying to shut down the immune system. So this is where it's not it's this mind-body connection, but it's not, I don't ever want to say to somebody that it's not that it's psychosomatic, it's that it's a real phenomenon going on in the body. So we have to learn how to deal with stress. So a certain amount of stress, of course, is fine. Most of us cannot eliminate too much stress in our life. But if there are some things that we have to make some lifestyle changes, you absolutely have to do it for your health. And I have patients come in and they say, I'm not sleeping because my job is demanding. They won't get healthy because they're producing all this cortisol. So we have to make some changes to reduce the external stressors if we can. And then we have to learn techniques to relax us so that we at least start training our internal, especially our brain, so that we're not under a stressful situation. And this can be somebody who's had trauma in the earlier part of their life, then they kind of are always in a state of anxiety, but they may actually be in a very safe environment. So that's where things like stress reduction techniques come into play. Or the PTSD, we've got all these veterans coming home, and they have been in this constant state of fight or flight. And this person needs to learn how to not produce cortisol if they hear a sound in the middle of the night, not thinking that it's, a gunshot. So that's where these stress reduction techniques are actually necessary. And we all have to learn them. We've just, becoming an adult, you have to learn to not fly off the handle, in every circumstance. But it's for the health of your body. And it can cause weight gain. It can cause, as I said, thinning skin. This is a dangerous state. It's a breakdown state in the body. The factory's on fire, so it says, let's just get rid of the rest of it so we can get through this fire. So it's a breakdown of the whole system. Okay, so let's talk about the next hormone, and that is DHEA. So here's one. DHEA, it's a long name, and it's also a steroid, just meaning that it comes from cholesterol. And DHEA is kind of an interesting one. It's a precursor hormone. Some people have called it the grandfather of the hormones. I'm going to show you kind of how they break down in a moment. So cholesterol converts to another hormone we'll talk about, and then it converts to DHEA. DHEA usually goes down two pathways, one towards estradiol, which is that female hormone, and the other one towards testosterone, which is the male hormone. In the case of a woman, right, she's already making estrogen, so when the metabolite, when it starts to go down that pathway, it sees that there's enough estrogen there, so it goes down the other pathway of testosterone. So this is a nice one to do for usually menopausal women, where most women are low in this hormone anyway, and then it can give them a little boost of energy. It acts like testosterone, so it can increase libido, it can increase muscle strength, energy, it can increase our metabolism, so helpful for weight loss, and it can increase dream recall a little bit too. So this is a nice hormone to add into the mix if you're low. So we'll do a blood test of DHEAS, that's the most active hormone to be tested in the blood. And the ranges are quite interesting because somebody will come in and they'll say, oh, that's fine for your age. But it's a little bit like getting your eyes tested. If you go and get your eye exam and they say, oh, you have 20/80 vision, but that's fine for your age, we're not going to correct it. You, of course, would want to be corrected to 20/20. So that's what we're doing when we're optimizing the hormones, if we can. Trying to get you to this optimal state, maybe the way you felt when you were 40, not when you were 20, and to get you back to this optimal state. So when we look at reference ranges, it's really good to look at sort of a 40-year-old reference range. So DHEA, now in men, it can convert to estrogen. Again, it goes down that pathway. So in this case, it sees there's testosterone there. So then it says, okay, we'll go down the other pathway. But this is as it breaks down and leaves the body. Before that, DHEA is also found in high density in the brain. So it's very neuroprotective. I've heard some great lectures by neurologists, and they'd say that there's high amounts of DHEA and this other hormone that I'm going to talk about in the brain. So we want to do everything we can to preserve brain function. So it's preserving the volume of the brain, and it's keeping the nerves healthy so that we can prevent cognitive decline and dementia. How do we supplement with this? This is a hormone. It just doesn't happen to be regulated by the FDA, but it is actually an active hormone. The problem with this is if you buy it over the counter, maybe it has the appropriate amount in it, maybe it doesn't. So you always want to make sure you get a good brand. This is when it's important to have your doctor, probably if they're, at least tell you what brands to buy or to dispense it from them. With women, we'll start pretty darn low at 5 milligrams or 10. And the problem with DHEA, as I said, it can go to testosterone, is that the side effects of testosterone can be a little bit of acne or facial hair. So we just kind of go slow and steady on this one. So we don't want a woman to have these androgynous, male hormones if she doesn't have enough of her female hormones there. When we're young as women, I talked about this with menopause, we have a lot of estrogen, a little bit of testosterone. If we go through menopause, the estrogen drops, so the testosterone has a little bit more value, and that's where we want to watch with DHEA. Now in some women, this is a nice one to start with because it will convert down to the other hormones. So it's a nice precursor as long as we have all the right enzymes to make all these other hormones. So as I said, with women, we'll start usually 5, sometimes or 10 milligrams a day. You want to take it with food. It's a fat-soluble hormone, and usually in the morning. As I said, it might increase libido also. With women, well, we may go up to 25 milligrams. Occasionally, we'll go up to 50. Most of the time, we're at 10 to 15 with most women. With men, we usually go ahead and start at 25 milligrams, and we may go up to 50. So we'll have your baseline blood levels drawn. If you do the saliva cortisol one, they will also do DHEA. So we'll test you at the beginning. If we decide to prescribe, we may do the herbs here, we may do the glandulars, we may do the actual hormones, and then we'll retest you. DHEA, I would test probably 2 months later, see how your symptoms are, if they're getting resolved, and check and see if your blood levels are at an optimal level, making sure you don't have any of the side effects. The next one is called, it's a mouthful, it's called pregnenolone. And actually, the whole hormonal matrix is a very, very complicated system. But the first thing that happens is cholesterol converts to pregnenolone. And then it has all these different pathways. Then it converts to DHEA. I'm oversimplifying this. It's not 100% accurate, but it's close enough for today's purposes. We get progesterone. Let's do it another way. And this is in men or women. As I said, it's oversimplifying. But we need cholesterol to make our hormones, and then enzymes come along, and it depends on what tissue it is. So in the adrenal glands, when the cholesterol's there, it has an enzyme to make pregnenolone. It has another enzyme to break down pregnenolone to make DHEA. So this is why we have different hormones produced by different glands in the body. Whereas in a woman, we have ovaries, and the ovaries produce estrogen and progesterone. So they have all these enzymes to break this down into these pathways. In a man, their testes produce testosterone. So all these different pathways depending on what organ it is in the body, what gland it is. So pregnenolone is really, if DHEA is the, kind of the mother hormone, pregnenolone is kind of the grandmother hormone. Now, if life were easy, we would just give you cholesterol and you'd make all your hormones perfectly, right? And that's sort of what happens when we are younger. But because of all these enzymatic pathways, because of aging, we can't do that. So we try to plug in and optimize where we can. So pregnenolone, it doesn't have a lot of effects that are sort of tangible in the way we feel and the way our lifestyle or our state of being. But it's precursor, so we want to get that kind of foundational support to make the rest of our hormones. And it is also found in high density in the brain. So this is really important for memory and cognition, mental decline. So I like to really optimize this one, get the numbers up well. And again, so we checked your blood as your baseline. We'll supplement you for a couple months, and then we'll check you after a couple months. And these are, if you feel well on them, you will stay on them probably the rest of your life because your body will never reproduce them again. If you're wanting to have a healthy lifestyle all the way through your old age. Now, the other thing about pregnenolone is that if we're not stressed, then we produce progesterone. And progesterone is another, so these are anabolic hormones. These are building blocks in the body. We make muscle with testosterone. We ovulate with estrogen. We form breast tissue. I mean, it's a healthy hormones in our body. Cortisol is catabolic. This is the one that's breaking down the body to get through the crisis. So again, we don't want to be in this state. There's a phenomenon we call the pregnenolone steal, or the cortisol steal. It's used either way. So under stress, pregnenolone goes all the way to cortisol. It just shoots right down there. We don't make any progesterone. So this is very interesting with the perimenopausal woman. And watch the video on perimenopause where I talk a lot about the effects of the two hormones. So progesterone is a calming hormone. So you can see once again, if we don't have enough pregnenolone, or if we're making all this cortisol, we're going to be in this fight or flight, and then this progesterone is going to add to the picture, and we won't be able to sleep at night, and we'll be anxious, we'll have PMS kind of symptoms, we'll be irritable, and probably have insomnia. So we're going to check these levels of pregnenolone, we're going to check your levels of cortisol, we're checking progesterone also if you're a woman, if you're having hormonal changes. This one is also over the counter, meaning it's just not, it's not a prescription. However, there are some pharmacies that will make these. That's not quite necessary. You just have to make sure you get one that's dispensed by your doctor. And the ranges are anywhere, I think they even make 5, 15 milligrams. I think that's not enough. I usually try to get the levels up to the mid-range, and it usually requires 50 to 100 milligrams of pregnenolone. I just had a patient today, actually, a new patient, and she's very concerned about dementia in her family. Her family has a big, high history of dementia and cognitive decline, probably Alzheimer's. And I checked her pregnenolone levels, and it was the lowest I've seen in anybody. So I'd really like to make sure we're getting all this pregnenolone to support her brain. We don't know if that's the same condition that her parents and elder relatives have gone through, but we want to make sure that we're going to support the brain as much as possible. So when you take pregnenolone, it's not a real big bang for your buck as far as feeling great, but most people, if we've gotten the levels up where we want them, after about 2 months on this, he will just start saying, yes, I'm remembering things better, and I just feel like my brain is working well. So those are the other ways to supplement these hormones. Let's see. Do we have any questions? Did some questions come in from the internet? Not yet. Okay. All right. So this is basically kind of the whole adrenal picture. What's important about this, right, are the two main things we hear about. Right, so these are kind of the catchwords that you're thinking about when you're talking about the adrenals, is fatigue and stress. What's really important is this is pretty scientific. You shouldn't start treating yourself. People are buying DHEA over the counter. You really need to know what you're doing, because as I said, as a woman, you're just going to get acne or facial hair. And also, DHEA, it balances cortisol. So if your cortisol is low and you take DHEA, it's actually going to drop it a little bit lower. So you don't want to be self-medicating here. Herbs you can try. I mean, you know, some things you can work around a little bit, but you really just want to make sure that this is a medical picture. The problem when we do have these things that aren't controlled by the FDA is they are over the counter. So first of all, you're going to take them. We don't know if there's anything in them. We don't know if there's too much in them. And we don't know if you actually need them. So you always want to check your blood levels of this too. And remember that these are hormones also, and they also convert down to the female and male hormones. So they do affect that. They're involved in that whole picture. Okay, I think we're almost done with that. It's a little shorter talk tonight. Maybe one or two words. The adrenal glands and our thyroid glands work hand in hand. So it's a little tricky when you first come in. Most people are complaining of fatigue. It's a little tricky to figure out if it's your adrenals or your thyroid. The adrenals kind of jump up and down. If you're really not making any cortisol in the morning, then you know, it's this kind of constant state of fatigue. You might get a little bit of the fight or flight, so it's usually a more brittle picture where you feel fatigue most of the time, but all of a sudden you get into an anxious state. So if you don't have enough cortisol, you go right into adrenaline, which is, again, that stronger fight or flight. It's really the emergency kind of last bit of stress hormones that we produce. And I think we have a question coming in from online. Should we take that? You ready? I'll take it. Okay, so somebody said my 22-year, it's from Romana. Hello, Romana. My 22-year-old son was negative for thyroid issues. Now the endocrinologist wants to check cortisol levels. What are the best tests? First of all, be careful about if your endocrinologist says that the thyroid is within normal range. Let's talk for a second about normal ranges. When a lab takes in all the samples, whether we're talking about thyroid, DHEA, adrenals, cholesterol, whatever it is, the standard is they take all the samples in, and they have to take the mean plus 2 standard deviations away, and that's what we call normal. This is just the standard we've devised in the medical community, you know, decades ago. So that includes 95% of the population. So if you have a doctor who is not really thinking outside the box, they are only going to be concerned if you're in the bottom 2.5% or the top 2.5% outside of these ranges. So think about this. I like to liken it to academics. It's a little bit like saying we're only going to look at you or remark something if you're an A+ or an F. What about if you slide from a B+ to a D? Your doctor will say, that's normal, go home, you're fine, you have your complaints are all in your head. So I would really be, if your son is having hypothyroid symptoms, and I'm going to do another webinar talking about that again as well, but if you can do a little bit of research, if he's having a lot of hypothyroid symptoms and the doctor said he's fine, he's normal. Be careful, because we want to make sure that he's in optimal ranges. Again, he's not slid down to sort of a D when maybe he was a B before, or maybe he's always been struggling at this low range. We don't want to wait till he drops to an F as far as, you know, that analogy goes. So first of all, make sure you have somebody that's concerned about that. I like that your endocrinologist does want to check cortisol, because many endocrinologists won't do both thyroid and adrenals. So he's going to check cortisol. The trick about cortisol is they do stimulation tests, which is important. Most of the testing is to diagnose these extreme states. And if your son collapsed and ended up in complete adrenal collapse, of course we need to do that kind of test. But most of us are running around just feeling fatigued, or kind of in this low end, sort of that, you know, B minus C, D range. We haven't dropped all the way to the F. We know what that F looks like. You ended up in the hospital, whether it was, you know, adrenal collapse or some other, you know, an infection in your life, something like that. So she wants to know, Romana, what to do for your son. He's 22. I would go ahead and do some blood levels, at least of cortisol, DHEA, and pregnenolone. He's young. We probably won't give him DHEA and pregnenolone, but just see if he's making enough cortisol first thing in the morning. And then your endocrinologist, depending on what his situation is, may do that stress test. So they're going to give you some dexamethasone, which is a synthetic cortisol, and they're going to see whether the pituitary responds. There's a couple different tests to do, whether it's central or primary or secondary adrenal fatigue. Another question? A couple more? Somebody asked, will taking pregnenolone make me feel calmer? I have high anxiety. So there's a good chance it will. It's pretty subtle. It might not for several months. Progesterone, did we see, is this a woman? Yes, this is a woman. So there's a good chance your progesterone is a little bit on the low side, or there's a good chance that you're producing cortisol late in the day or maybe early in the day. So you could take that phosphatidylserine, that HPA balance, and that will calm you down. As far as other anxiety supplements, magnesium is wonderful. It's muscle relaxant. It's a little bit of a laxative if you tend towards constipation. It can calm the brain. It's also used in our energy cycles in the body, so it supports any production of glucose or energy from glucose. So but some people do respond pretty well to pregnenolone. It's definitely calming, if anything, or it's sort of neutral, and then it can go down this calming pathway. Okay, was there another one? Oh, here's one behind here. Okay, so here's some physical manifestations that Mike is asking about. He says, are aching heels and weak legs signs of adrenal fatigue, and also vertical lines in the fingertips? So there's a couple interesting physical signs of low cortisol. One of the most interesting ones is actually darkened spots on the skin, and this was from Addison's disease, which is extreme adrenal collapse, and that's what JFK had. Remember how he always looked tan? And the reason is because ACTH, which is in the pituitary, is attached to MSH, which produces melanin, which is what makes our skin tan. So it's screaming at the adrenals to do their job, and it also ends up making excess melanin. So we sometimes see darker lines in the creases in the hands with low cortisol. Aching heels and weak legs could be not necessarily, though. I'd like to see what else is going on. The most common ones are kind of this lightheaded, this basic fatigue. The joint pain, if we see that, I know you're talking about your heels, but that joint pain can be more of thyroid disease. And then vertical lines on the fingertips. I'm wondering if we're talking about fingertips or fingernails, but probably the fingernails. So when your body goes through stress, your nails, you can see, they'll sort of record it, and that's usually actually the horizontal lines. The vertical lines are often aging. It's often human growth hormone deficiency, DHEA deficiency. One more. I think this is our last one. Okay. What, if anything, changes after you have a baby? This is from Syncotic. What, if anything, changes after having a baby? I have some women in the audience, they're all saying everything changes. So it's a big stressor on the body. Your hormones shoot up when you're pregnant and then they drop down, especially if this is your second or third baby and you're older, even just 30s. Everything gets stressed in the body, and your adrenals. The adrenals are kind of interesting. When our thyroid is not working right, and if our ovaries or testes are not working right, so we're going through menopause or andropause, if those aren't working right, the adrenals try to take over. And what's interesting, what they can do too, and what the body can do, is that the body says, we're not making enough testosterone, we're not making enough estrogen, we're not making any progesterone. What should we do? Well, let's hold on to the first ingredient. So the body holds on to cholesterol. So when we have people, especially with also low thyroid, cholesterol tends to be high. The body's trying to store this cholesterol. Where do we find cholesterol? In the fat. So the body holds on to fat, and it tries to use some enzymes to make these hormones. So it'll make some pregnenolone, maybe it'll make some DHEA, and it's trying to do this whole pathway. So what can happen postpartum is that your ovaries haven't quite recovered yet, and so you might be making, your adrenals are just trying to do double duty, and that's that fight or flight. Obviously you're not getting enough sleep, so you're back to this whole picture. Who knows what the curve looks like for you? You're probably, kind of zigzagging all the way around, but if you're young enough, you probably are doing fine. And then we often have progesterone deficiency. If you're having any postpartum depression, it's often because of the progesterone deficiency. And get that checked soon. Sometimes your body will recover, but that can be quite damaging to the mind and the body. Was there one more? I think we have one more. This is the last question. Somebody asked, this is Robin, she wants to know, what is an optimal blood serum aldosterone level? I'm forgetting my numbers, but I believe there's a range, and it depends on if you take much salt in your diet. So if you have a low salt diet, the range is quite different. So I believe it's around 100. If you want, I'm going to go check mine, and I'll answer you back on. I believe this was on Facebook, so we can answer you tomorrow, and I can give you kind of a nice range that Terry Hertog, who's a pretty famous endocrinologist and anti-aging from Belgium, and he gives a nice little range depending, as I said, if you have enough salt in your diet. Now again, remember I said this one is the really short half-life, which means that it's going to change kind of moment to moment in your body. So I don't always check for this. I will sometimes do it initially, but we can usually check clinically. Again, it's this person who gets really lightheaded when they bend over and stand up. And this can be quite extreme too. This can be the person who stands up, they feel so lightheaded, they get dizzy, and they might get tachycardia. Their heart rate might also increase, and that's a different syndrome. It's a more severe picture of that syndrome. It's called POTS, or postural orthostatic tachycardia syndrome. And that's quite an extreme case of it, and we can use a couple different medications as well as adjusting the adrenals to get you there. So your doctor may not even check for the serum aldosterone levels, but if I'm recalling, it's around 150, and there's a little bit of a range, and I'll answer that on Facebook for you. So this has been fun. This is Health Chat number 5. Next month we have a new one. One of our colleagues here, Dr. Wayne Whiteman. We're going to do Wayne's World of Medical, what are we calling it? Wayne's World of Medicine. So he's going to come on, and he's going to talk about male hormones, about testosterone deficiency, andropause, so it's the parallel to women going through menopause. So women, bring your husbands in to watch it. And so he'll be doing that next month. And we have a few other ideas. I'm going to do another talk on thyroid also, just kind of a nuts and bolts of how we break it down, how we interpret our lab tests and all of that. Please email us or put some notes on Facebook. Please give your reactions. We also have consultations too. If you live far away, I can't treat you as a doctor, but if you have blood tests that you want some help interpreting, then we can do that on the phone, and that's our nationwide consult. So thank you everybody who's here and at home. We'll see you next month. Thank you.
Thank you for joining us for tonight's Health Chat with Dr. Nancy Evans, all about adrenals. We hope you found this information useful as you search for ways to improve your health. If you would like to schedule an in-office or phone visit with Dr. Evans, please submit the form below and one of our new patient consultants will contact you. Join us next month for Wayne's World of Medicine with Dr. Wayne Whiteman. Have a great evening. Thank you for joining us for tonight's Health Chat.